Hi, I'm Dr. Diane Cannon, Director of Clinical Education and Innovation with Xapimed.
Hi, I'm Nick Stevenson, CEO of Xapimed.
Nick and I just got back from Atlanta, where we were at the ANPD Aspire convention, and we spoke with a lot of nursing professional development practitioners who were very frustrated with their current LMS system. And we understand why LMS platforms and software don't work for nursing competency verifications. So we thought we'd make this video explaining the difference between an LMS and a CMS.
That's right, Diane. It was just a constant theme. People coming up to the booth saying, hey, we've seen your presentations on digital competency management. We've got a learning management system. It's causing more frustrations than benefits. We're not sure why. How do we deal with it? How are you different? So I think we need to look really quickly at what the systems are supposed to do. So a learning management system is designed to really deliver learning and verify knowledge. And we've all used learning management systems. You do an online learning module, you complete some quizzes, the system ticks you off as being complete. So you've verified knowledge. Competency management sounds similar on the surface. Well, where you're actually doing is verifying competency, be it at the point of care or be it via evidence of daily work. But there's a but. They are actually feature-wise require very, very different capabilities in order to make that happen, particularly for nursing, which has a whole set of variables which are unique to healthcare.
Right. And it's those complexities within the verification of competencies that makes the learning management system inadequate. So we know that nursing competencies are so much more than just a checklist or learned knowledge or understanding of a concept. We know that nursing competencies involve many things: understanding, the learning, the knowledge, the ability, the skill, and then performing it in the safest manner, and the context of how it should be performed, in which manner. That really leads to different workflows and different needs for verification methods.
It sure does. And I think we're getting down to the heart of where people end up using a learning management system in the first place. So in nursing professional development, from an outside observer's perspective, particularly IT or procurement or someone selecting a system, they kind of see that, okay, the checklist seems to be the center of this. Nurses getting signed off on competencies and that being reflected somewhere. And that's sort of, if you're just sort of looking from the outside, it's easy to get your head around. It sort of makes sense. So that's the way they're doing it with paper. So your learning management system provider comes in and says, hey, we've got checklists. You can sign off on competencies. You're good to go. Great. Everyone's happy. We're using one system. But practitioners know that's actually not the case, because the checklist is merely a method of record keeping and stuff for Joint Commission surveys. It's important, but it's actually the workflow. It's actually what NPD folk do around that checklist is where the magic happens. It's the coaching, it's the interventions, it's the giving someone more time, it's making sure this is done over a bunch of days. That is where precepting really happens. And LMS can't support that because it's just got this idea of learning content and the quizzes, or learning content and checklists. What it doesn't do, it doesn't manage all those workflows around precepting that professional development people do in the course of their jobs. So in order for a competency management system to work well, it needs to support all those workflows.
So what would be those features that make competency management system support those type of workflows?
There's a couple of parts to it. Let's start with user management. User management is a really, really boring topic, and you see the blood drain out of nursing leaders' faces when you have to discuss this stuff, but it's really, really important
boring,
because...
right? I mean, it's very techie, boring stuff.
It's
the key. It is the key.
It is. That's right. It's insanely boring when we go through it, but it is the key. So if you think about, again, let's go back to the learning management system, and how that works is that you have a learner, logs in, sees some content, does a quiz, gets ticked off, for example. That user management is really, really simple. You're just linking up a learner to a job role, to some content, etc. Whereas if you look down on the floor, what's happening in precepting, you have all these complex relationships And those relationships have to be reflected and supported by the competency management system. And let's start with some basic scenarios. I am a new nurse on this ward. I have 2 or 3 preceptors that I'm working with. The system needs to know that I'm this nurse and that these 3 preceptors, based upon organizational rules, can work with me to develop and sign off on skills and competencies. So there's a relationship there between one user and 3 preceptors. But then as that user perhaps moves across different roles and different units, they're going to have more preceptors. And then you're going to introduce other complexities like who is their supervisors? Are they being mentored by someone? Are they job shadowing someone at the start? So the system has to have really, really, really strong user management, which takes this one nurse and then effectively builds a network around that nurse of the people who are supporting and developing them in their competency journey. And then if you multiply that one nurse by thousands of nurses, you have a huge network. The user management around that is the most important thing to a good competency management system that really supports the reality of what happens in the world of nursing and nursing precepting. And we need to go a little bit further than that. So you've got this huge complex network of people and how they relate to each other and who can do what and the rules around that. How do you get that data in? And so obviously that's just something which just cannot be managed. Well, could be, but it'd be
manually. It would make me crazy.
It would be a horrific process. So then what you've got to look at is the tight integrations it has with your other systems so that your competency management system knows who can precept who has what skills and competencies, et cetera, and can then build that and mirror the real organization in the system. So that's the most important thing. Then there's the workflow component, and workflows, once you've got your user management solid and you've really got that right, it empowers all sorts of workflows which would not otherwise be possible. So if, for example, a nurse is perhaps not performing as well as hoped in a particular competency sign-off process, what are the workflows around that? How do you automatically provide interventions and support to that nurse such that they can be signed off on that competency at a later time? What do those workflows look like? Do you assign some coaching automatically? Do you add a delay and give them a few days to think about it and practice and then come back to them? Now, this happens all the time in precepting, is that NPD nurses are already doing this, right? They're just doing all these workflows, but they're dealing with them manually. The competency management system has to just replicate what they're doing manually and automate it. So if you've got really, really good user management and you've got really, really good workflows, all of a sudden you can automate a lot of that tedious paperwork that NPD folk have to do in the course of their days. And it's just so much more than a checklist, which is what your learning management system has and what your procurement IT people may think is the answer to the problems.
Absolutely. And we all know that nursing competencies are so much more than just a checklist and items on a checklist to be ticked off. It really reflects what's really happening within the process in real life, not in imaginary computer world, right? So because we understand how nursing works and all of the gray areas and the complexities within that process, we can take that knowledge and understanding and build out this system that really does reflect what's actually being done in real life.
That's right. And, just something you've said there is the gray areas. Systems are often very rules-based. So you're looking at, I'm in this group, I can do these things. But nursing's not like that. People float across units. People have side gigs working in other units on other days, et cetera, et cetera.
Or in a float pool, in an internal.
Yeah, exactly.
Or work in inpatient for a couple of days and then go to ambulatory care. So it's all those gray areas that are nuanced within nursing that we understand and we.
Yeah, and you learn those lessons by building systems specifically for nursing, and those gray areas if you don't get it right, it just adds so much overhead and cognitive load and workarounds that, all the stuff gets too hard. One classic example we always use is someone's gone on leave unexpectedly or off on a few days. Who can pick up those precepting roles quickly and easily? A good system will support all of that. An LMS and not so well-designed user management systems are going to just struggle with those scenarios, and you're just going to be in a position where you're doing manual workarounds again to deal with system or deficiencies.
Exactly. Well, I understand it. I hope our audience understands it. I really appreciate you breaking it down into easily digestible bits of common language to where, the nursing professional development practitioners can understand why they're feeling so frustrated with their current LMS, and maybe use this information to speak to their team or if they have a professional governance council or wherever they are in the process of trying to digitize their competencies. I hope this helps them, and I hope they reach out to us for more information.
Thank you very much. Good stuff.
Thanks, Nick.